Good day. Welcome to the GAS 107 course. I am Adeshola Ogunniyi, Professor of Medicine, Department of Medicine, College of Medicine, University of Ibadan. And the topic is non-communicable diseases. The learning objectives are the following. At the end of this lecture, the attendee should be able to differentiate between communicable and non-communicable diseases, understand the risk factors for NCDs, recognize the complications of NCDs, and itemize preventive strategies against NCDs. So this will be the outline of the lecture. We'll do a brief introduction and provide some definitions, talk a little bit about epidemiology of NCDs, and list the factors associated with the increase in NCDs, and describe specific examples: hypertension, diabetes mellitus, obesity, stroke and ischemic heart disease, dementia. And then I'll end with ideas on how to prevent NCDs, some useful hints. Non-communicable diseases are medical conditions that occur in individuals that are not due to transmission from one affected person to another. So they can be regarded as diseases associated with lifestyle changes or diseases of affluence. These are diseases that are more common in Western societies and are not caused directly by infections, and they are not associated with person-to-person spread. And examples of NCDs are on this slide: hypertension, diabetes, obesity, stroke, cancer, chronic obstructive airways disease, asthma, neurodegenerative diseases, chronic kidney injury, traumatic brain injury. The list goes on and on, but these are the key ones. I'll use some of these to illustrate the consequence of non-control of NCDs later. It's important that we should differentiate NCDs from communicable diseases. Communicable diseases are those that are transmitted through contact with an infected individual. So they are transmissible diseases and usually infective conditions. And the best examples in contemporary times include COVID, which is now a big pandemic worldwide, malaria infection, HIV, tuberculosis, meningitis, and sexually transmitted disorders. The etiologic agent for communicable diseases can be diagnosed through study of biological fluids and tissues, whether you do a virological study or microbiological studies or genomic studies in recent times. These diseases are usually treated with antimicrobial agents. Mass vaccination can eradicate these diseases, and public health measures are important in combating spread. So in this way, you can think of how NCDs are different from NCDs, and how non-NCDs or communicable diseases are different from NCDs. So we're going to then thereafter focus on NCDs. Now this is just to show us, this is an old slide but it's still very relevant. We have the regions of the world, WHO regions of the world: Africa, East Mediterranean, Southeast Asia, West Pacific, America, and Europe. And in orange, we represent the magnitude of non-communicable diseases. Yellow represent injuries, and the green represent the communicable diseases. You can see that in Africa, we have a major problem with communicable diseases. Then in next importance are NCDs, and then we have trauma. Compared with Europe, where their major problem is NCDs, and we have less problems with injuries and communicable diseases. And if you look at the same pattern can be said of America and West Pacific region. If you look at East Mediterranean and Southeast Asia parts of the world, they have a lot of communicable diseases, which is counterbalanced by non-communicable diseases and very little injuries. So in a way, we can say that in Africa, a major problem is communicable diseases, but the pattern is changing. Whereas in the Western world, major problem there is non-communicable diseases. Why the interest in NCDs? It's been noted according to the World Health Organization in 2017 that NCDs kill 41 million people each year, which is about 71% of the deaths annually. And each year, 15 million people die from NCDs between the ages of 30 and 69, which are the productive years of life. And most of these deaths, about 85% of these premature deaths, occur in low and middle income countries. You can see the spread. Cardiovascular disease is about 18 million, cancer 9 million, respiratory diseases about 4 million people, and diabetes 1.6 million. So this is the reason why we're interested in NCD, because they are diseases that kill the majority of people in their prime of youth or in the productive years. And this is just to show the pattern of NCDs, and you can see the deaths. The red color shows excessive mortality, as you can see. Any mortality more than 850 per 100,000 will be depicted in red. And the light green, it's about less than 450. And you can see that America, you have less death there. So even though we don't have a lot of non-communicable diseases, according to WHO, you have a lot of death from these disorders because we don't have the resources to manage this. So you can see a lot of West Africa. Most of it is in red color. Now this is a global analysis of death. This was in 2016, just to show the major causes of death. And you can see that communicable diseases account for only about 34% of the deaths, whereas non-communicable diseases account for 66% of the deaths. 11% cardiovascular, neoplasms, cancer, that's 8%, diabetes 2%, respiratory disorders 3%, and other NCDs about 29%. And then we have 13 due to trauma. So 66% of global death in 2016 in those below the age of 70 years were mainly due to non-communicable diseases. And this is why there's a lot of interest in this, and we must talk about this. And there's a projection, this was data from WHO again, just showing projection between 2004 and 2030. And you can see that the projection is that neoplasms or cancers will continue to increase, ischemic heart disease will continue to increase, stroke continue to increase, whereas respiratory infections might go down, all the other infectious conditions might either plateau or go down, but non-communicable diseases will continue to rise. And the burden of this will be borne by low and middle income countries. This is just our own experience from Ibadan, and I've compared data during 2 time periods, 1957 to 69, that was about 6 decades ago, compare what happened about 3 decades ago. You could see that at that, in 1959 to 69, infectious accounted for about 47% of the cases, whereas 3 decades later, only about 12%. You could see increase in stroke, epilepsy, and neurodegenerative disorders. The others appear to have plateaued. So it means we're seeing changing pattern of diseases. Why do we have increase in NCDs globally, and particularly in low and middle income countries? We have increasing urbanization. There is economic prosperity, so people are living better. People are also living longer. Life expectancy has increased tremendously. So neurodegenerative diseases have become more important. We're noticing dietary and lifestyle changes, and I'll show you a few slides of some of this. And we have a change in disease pattern from infections to non-communicable diseases, as I've shown in the experience from Ibadan. Now we can see that now we have a lot of eateries where people go and eat hamburgers, and you can see the juicy hamburger there. I'm sorry I used Mr. Big. This was an old slide. We know that Mr. Big is no longer a successful franchise. I think now we have better ones, Mega Chicken and Chicken Republic. So subsequent slides might have those ones, or even newer ones at that time. So people, rather than eating the traditional meals, now opt for this refined food, which was usually rich in a lot of salt and animal protein. And so people then tend to get fat. Second one is that people drink a lot of carbonated drinks. And you can see what happens. 1 can of Coca-Cola actually contains 10 teaspoons of sugar. And you'll be surprised that some individuals drink 4 to 6 cans of Coke every day, which means they are taking a lot of sugar into their body, more than the body can really have capacity for. And this varies with the kind of drink, the amount of sugar in it, as you can see, and also with country. So the point is, carbonated drinks are not good because they load with sugar, and that increases the calorie demand, the calorie supply to the body. And you can see also our mode of working has changed from the traditional way of hoeing and doing that to sitting down and working with computers. And so we burn less energy, and that's also been known to contribute to development of NCDs. Then means of transportation have also changed. The rural traditional people will walk long distances, and we had stories in the past of old people walking between villages without caring about the distance. They go in the morning and come back in the evening, carrying loads on their head. But these days we have cars and all that, and we know the problem of pollution and the damage of that to the respiratory system. So these are some of the reasons why we are seeing changes in the health pattern. Well, we can then put this graphically, and this is obtained from the internet. So we have evolutionary and epidemiologic transition taking place, and you can see what happened. This was the ape, and see how it transformed with time to become man, and see what has happened to the man with coke, and it's become so fat. And we've moved from hunter-gathering, using simple instruments for doing this, to a situation where we just sit with computer. And again, these changes have contributed to development of non-communicable diseases globally. And low and middle income countries are even worse off for this, because we are becoming less active than we used to be. So let's give a few of the examples. So the first one is hypertension, which is high blood pressure, and usually written as a ratio and expressed in millimeters of mercury. The upper value is systolic blood pressure, the lower value is diastolic blood pressure. And blood pressure is usually presented as normal systolic blood pressure of 120 to 139 and diastolic of 70 to 89. So in essence, it assumes that everybody whose blood pressure is 140 over 90 has hypertension. The cutoff value keeps changing, but you can take it that what blood pressure of 135 over 80 is ideal, and anything higher than that is bad. So please note that. We can measure blood pressure using a sphygmomanometer, and this is the one that you'll find in most clinics. A mercury sphygmomanometer. This is the cuff, and it's connected to the mercury column. Unfortunately, we can't see it well, but the value goes as high as 300 millimeters of mercury. You never want to reach that pressure at all. Like I said, it's 130 over 85 that you want. But you can also have the electronic one, and home run is a popular one. It can be like a cuff type, and then you have the machine that will record the blood pressure, or the one that goes around the wrist, like a wristband, that also does blood pressure measurement using the same mechanism. Now, these are just values of blood pressure in Nigeria, and I want you to focus on the timing of these studies. When Akikugbe did the National Survey of Hypertension, he reported a mean blood pressure of 11.2%, and it showed that the blood pressure was higher in urban communities than in rural communities. Kadiri study 2 years later had a range of about 9.3, which was close to Akikugbe's. But later studies, especially by OGA, showed that blood pressure could be as high as 31%. So there's that feeling that blood pressure is increasing even in communities. And this is a diagram obtained all over Africa. I don't have time to go through all the details, but it shows that the blood pressure in rural area varies between 18 to 30 to 46% in West Africa. In urban areas, it goes between 22 and 42%. So, and you can have that for South Africa, East Africa, Central Africa. Just shows that blood pressure is much higher than what was quoted in the past. And this is a reflection of changing pattern of diseases. These are the things that are predisposed to hypertension. I think the first one is age. You can see that as people get older, and I alluded to longevity. So look at the blood pressure in 75 to 84, 35%, whereas 25 to 34 years was 6.5%. So age is a risk factor. Blood pressure increase is also favored by urban dwelling, by cigarette smoking, heavy alcohol consumption, physical inactivity, and increased body mass index. And I'll talk about body mass index in a short while. So those are the things that increase blood pressure. So hypertension itself is referred to as a silent killer, because people have the disease and they are not aware, and it does its damage to the body. And it's estimated that about 7.6 million deaths in 2001 were caused by hypertension. The 1/3 rule applies. A third of individuals who have hypertension are aware of the diagnosis. A third are on treatment, and only a third comply with therapy. And there are many reasons why people don't comply with therapy. Side effects of medications, the cost of drugs, and availability. and we've noted that prevalence of hypertension increases with age. Consequence of hypertension is that it damages the heart because the heart has to pump more forcefully, and that creates a lot of resistance, and muscles will then increase in size and later will fail to function well. It affects the brain, it affects the kidneys, it damages blood vessels. And how does it do this? As you can see, this is a photograph of a blood vessel, and this is the lumen of the vessel. Now I'm showing what it was. The outer extent showed the size of the lumen before hypertension setting. But with time, you can see progressive deposition of materials that encroaches on the lumen. And so this is what is left of the lumen of that particular blood vessel, which means that blood flow is then severely impaired. And such individuals can then have ischemic heart disease, can develop stroke, and have damage to other internal organs. So the consequences of uncontrolled hypertension include effort intolerance, heart failure, cough, a stroke, which I talked about, a chronic kidney failure, and they can have eye damage, which can result in visual impairment. The second one, which is always regarded as a cousin or sister of hypertension, is diabetes mellitus. And this is sweet urine, so excessive passage of sugar in the urine. So it's an endocrine disease caused by absolute or relative lack of insulin, resulting in elevated blood sugar. And this is just a diagram of the organ or the gland that is responsible, which is the pancreas that produces insulin from the islets of Langerhans, and that's just and this is the location in the body, just below the stomach. That's where the pancreas is. And it's also undergoing a growing epidemic, as you can see. 59% increase in the Americas, but 98% increase in the number of cases between 2003 and 2005 in Nigeria. And overall, globally, you expect a 72% increase in prevalence of hypertension and of diabetes. So this is just like hypertension, is also a rising global problem. Usually accompanies hypertension in causing disease of blood vessels. Prevalence is 3 times higher after the age of 45. Again, age is an important. Prevalence of diabetes is high in urban communities and forest zones than in semi-desert north. There are studies from Nigeria. And the risk factors for diabetes include being overweight, physical inactivity, alcohol abuse, and positive family history. You can see a kind of thread resonating through all these diseases: hypertension, diabetes. They all seem to be caused by the same conditions. The clinical manifestations of diabetes are varied. The first one is excessive urination, people waking up at night to pass urine. Because they pass a lot of fluid, they become thirsty, so they drink a lot of water. There is increased appetite. They notice that despite they are eating heavily, they are losing weight. Then if they have a wound, it doesn't heal on time. A small cut in the body will not heal, and they have to spend a lot of time going to clinics and having to dress these wounds, and it will still not heal. They're very prone to infection, so they have recurrent boils, and this will occur in terrible places all over the body. And when they pass urine and they go back to the urine, they notice that there are lots of ants crowding around the urine, and this could be very alarming. And sometimes it could occur in families. The complications of diabetes are associated with very poor control, because the treatment is replacement of insulin or to use medications that will ensure that the blood sugar comes down. Complications are associated with long duration of disease, and especially if you then have damage to blood vessels, which will then impair flow to the organs or parts of the body. And so you can imagine with the diagram I showed on hypertension, combining that with diabetes, then you know that the outcome is very bad. The complications also are associated with very high blood sugar levels, which can result in loss of consciousness and can also result in stroke and ischemic heart disease. Individuals who have diabetes develop ulcers because they don't feel very well, so they then have injuries that they are not aware of and can result in loss of digits. They can develop cataracts, and so they may lose their vision. And because the wounds don't heal on time and they're prone to infections, gangrene will set in, which can result in amputation of legs and arms and all that. And that's a disabling condition it causes a lot of depression. And they can have chronic leg ulcers that with foul smelling discharges that really is a sorry sight. You don't want to come in contact with such individuals. So the third one I'm going to talk about is obesity. And I've shown you diagrams of individuals with obesity. I showed that it can affect men, it can affect women, it can even affect uniformed officers. Because you expect that uniformed officers will be trim, but you can see that they also put on a lot of fat everywhere. So what's obesity? Obesity is excessive fat deposition in the body. And there are three ways in which you can determine this. The first one is the body mass index, which is the weight in kilograms divided by the height in meters squared. Normal BMI is 18.5 to 24.9. And individuals who have BMI of 25 to 29.9 are said to be overweight. BMI greater than 30 is referred to as obesity. And if it's above 40, it's morbid obesity and associated with a lot of complications. You can also determine obesity by measuring the waist circumference. And if the waist circumference is more than 40 inches in male or more than 35 inches in female, then you can also diagnose obesity. And the third way is to look at waist-hip ratio. Measure the waist and measure the hip, circumference of the waist, circumference of the hip. And when you divide the waist circumference by the hip circumference, if it's more than 0.86 in female and greater than 1 in male, then you can also diagnose obesity. And this is a global picture of the prevalence of obesity. This was about 2014, individuals above the age of 18. And you can see that America appears to be the culprit here. You can see the dark green color, America, Alaska, and also Argentina, and South Africa, as well as the Mediterranean regions of the world, the Arab countries. Nigeria here is still not a big problem. Prevalence is about 10 to about 19.9%. That was in 2014. So, but it's a growing problem and we need to be aware. And again, from definition I gave you, it was BMI greater than 30 kilograms per meter squared that was used for making that diagnosis. So what is the primary driver of obesity? It's either it's either too much to eat or less coming out. And I think it's probably more that they eat a lot and they don't exercise. So, and that's what happens. So excessive food intake is probably a risk factor for that. What are the complications of obesity? They develop gallstones very easily, which would then result in abdominal pain. They may have intolerance for fatty meals, they vomit, and they may develop yellowness of the eyes. Then because of the heavy weight on the joint, it damages the joint, so they have pain from the joint, osteoarthritis. They may have problems with sleeping, what we call obstructive sleep apnea. So they sleep and there's like cessation of breathing, which then has other complications. Then they are prone to heart attack, stroke, they develop diabetes. They can have gynecological problems, so fertility might be a problem as a result of obesity. They're also prone to cancer of the liver, of the stomach, and a few of the other organs of the body. And they can have fatty liver because of excessive fat deposition in the liver. So obesity is not good. Culturally, it's something that people used to like, that it's nice to be fat, but it has health consequences, and so it should be discouraged. So in summary, the risk factors for non-communicable diseases include raised blood pressure, being overweight, excessive or high blood sugar, and high lipids in the blood. I'm not talking much about lipids now because time is against us. And the last one is smoking. So all these five we need to do something about. But what are these diseases specific that these things cause? And just before that, I'll just give a summary of the data on the prevalence of these risk factors from a study of cardiovascular risk factor body in Africa and Middle East. I'm not going to waste time, it's just to show that smoking is not a big problem. You can see the prevalence is only 2%. In that study, diabetes was 21%, obesity was 24%, but when you combine that with abdominal obesity of 64%, then you know that obesity is a big challenge. Hypertension was 44%, and abnormal lipids 71%. So we must pay attention to abnormal lipids, must pay attention to obesity, must pay attention to hypertension, and then diabetes mellitus. That's the message from this data. So ischemic heart disease is also, as people get older, blood vessels start getting narrowed. The lumen starts getting narrowed because materials are deposited there, as I'd explained before. Symptoms initially will not be there at age 20, age 40, from about age 50. That's when the narrowing becomes critical, and then obstruction can then result in stroke or heart attack. So, ischemic heart disease is also called heart attack or myocardial infarction. It's a major cause of sudden death. It was once thought to be rare in Africans, but we now know otherwise, that now we're seeing more and more cases. And usually individuals will present with sudden onset of severe left-sided chest pain, and the pain may radiate to the arm, and then they may then notice difficulty with breathing, they may have a cough, and some may collapse. If they don't die suddenly, what they then have is severe breathlessness, and they become restless, and they're unable to lie flat without using any pillows. And the things that are predisposed to this are smoking, diabetes, hypertension, abnormal lipids, just like the earlier slides have shown. Next one is stroke. This is a brain disease that results from disturbance in the blood supply to brain cells, and there are two possibilities. One is occlusion of the blood supply or the blood flow, which then causes death of brain cells in distal parts, and that's called the ischemic stroke or infarction. The second type is where blood vessels rupture within the brain parenchyma, and the rupture can be within the brain, or it can be on the surface of the brain. So it can have bleeding into the brain substance in any part of the brain, or it could be on the covering of the brain, and this one is called a subarachnoid hemorrhage. Now, for the ischemic stroke, the first one I described, you can see various things that can happen. You can see this vessel that is so diseased, you can then see a clot formed, which will then prevent blood going to distal part. Sometimes materials can be carried from the heart and then carried through the blood vessels, which when narrowed can easily just lodge and impact there, so that flow to distal part becomes obstructed. So you can have substances carried from the blood through the heart, and then from the heart through the blood vessels, and then lodged in the brain. And this would be the embolic type of stroke. So those are the important causes of destruction of blood flow to the brain. Stroke currently is the leading cause of neurological admission at the University College Hospital Ibadan, where I work. Prevalence is quite high, and it's a major cause of death and disability. Just like hypertension, the 1/3 rule also applies here. 1/3 of those affected by stroke survive, 1/3 of them are left with disability, and 1/3 die. And there are various consequences of having a stroke. One is forgetfulness, the other is epilepsy, and another one is intractable pain. Patients with stroke will present with sudden weakness of one side of the body. They may present with sudden loss of vision, or sudden difficulty with speaking, or they may even lose consciousness. And some may present with sudden onset of headache, convulsions, and vomiting. And some may have problems maintaining balance, and all these things occur very fast. So there's an acronym for remembering this. It's called FAST, which is facial weakness, arm weakness, speech affectation, all occurring very fast. So time is important, and that's the message we preach. These are the risk factors, and it's almost like a recurring or broken record. Hypertension, diabetes, abnormal lipids, smoking, obesity, alcohol are the important risk factors. More recently, HIV infection is also an important cause, and COVID also is known to cause stroke these days. And sedentary lifestyle is a risk factor. The ones that we cannot do anything about is old age. As we get older, these events can occur. The male gender is at risk. People of the black race are also at risk of developing stroke. And individuals with family history of stroke, because of possible genetic underlying mechanisms, can also develop stroke. Sometimes other things can mimic stroke, and we need to be mindful of this. Because not every time you have weakness on one side of the body that is due to stroke. You must think about mass lesions in the brain. You must think of epilepsy. You must think of metabolic disorders in the body. You must think of infections of the brain that can also cause this kind of problem. And lastly, you can think of hysteria, what they call conversion disorder. Individuals don't have organic disease, but they mimic a condition, maybe because they want to get attention or for secondary gain. And so we need to be aware of this. Overall, about 1 in 7 stroke cases may be misdiagnosed, and so we must bear this in mind. And this graph shows some of the complications. Because of the paralysis, they can develop decubitus ulcers, skin breaking down. They have spasticity as a result of contractures as a result of spasticity. As you can see, that it's difficult to extend at the elbow because the muscles are tightly contracting. They may develop clots in the lower limbs, deep vein thrombosis, which can then lead to further problem. They have problems with walking. As you can see, this individual are trying to walk. So those are the important consequences of developing stroke. Others are epilepsy, pain, and others as listed on the slide. Another condition is dementia. I'm talking about dementia mainly because that's an area of interest that I have for research, and so we should just mention that. And because people are living longer, they're reaching ages where they develop neurodegenerative diseases. That's why this is important to be mentioned. It's a deterioration of intellectual functions and other cognitive skills, leading to a decline in ability to perform daily activities in the conscious and alert state. So we need 5 things when we want to diagnose dementia. The first one is cognitive impairment, impairment in activities of daily living, a retrogression from a previous level of performance, need for supervision in the advanced stages, and the patient must be conscious and alert. It's important to say that because if the person is not conscious and not alert, then the diagnosis will be delirium, not dementia. So it's important. Delirium is acute confusional state. This infographic from the Alzheimer's Disease International just shows a progressive increase in number of cases. In 2016, there were about 47 million cases, and it's projected that this will increase to about 132 million by 2050. And most of the cases, 68%, are in low and middle income countries. So that's a big challenge for us. At the rate that peak cases are accruing, it's estimated that 1 case of dementia is diagnosed every 3 seconds. So it's a global challenge. The only interesting thing is that most of the cases are in Asia, and that's not surprising because of the larger population in that region of the world. Africa at the moment still has fewer cases than the rest of the world, but the pattern will change because people are also aging. So what kind of patients are diagnosed with dementia? Individuals who complain of forgetfulness, who have difficulty using right words in sentences, who get lost in otherwise familiar places, individuals who cannot learn, individuals who cannot make very good judgment calls, individuals who have problems with managing their finances, individuals who may have some confusion, which may be acute or chronic. They may also have problems with handling their daily functions, like shopping, like cooking. When they cook, food gets burnt because they forget the food on the table. They have problems handling their drugs. They have problems with communication with family members. They cannot carry out their expected roles in the families. Their houses are usually cluttered and with smell of urine sometimes. They fail to recognize individuals, and they have problems with personal grooming. They don't dress well, or they dress inappropriately, and they don't feel that anything is wrong. They may also have some behavioral problems, which may be the thing that will alert people about something going wrong. They may appear agitated, they may be anxious, they may be unusually irritable, and everything they may put in their mouth or sleep when others are awake and keep awake when others are sleeping, so they disturb other people, and they may manifest disinhibition, so they undress without feeling that they are doing anything bad. And those are concerns that will then lead to stress for family care members and can result in them being kept at home. And sometimes they wander around, and when they wander around, people might mistake them as being possessed by an evil spirit and might stone them, which had happened in the past. In the late stages, the disease is very terrible. The person is more or less dehumanized. They have problems with eating and walking. They have problems with understanding events. They are incontinent of urine, and and stool. They behave inappropriately in the public and they lose their way around. And sometimes they are confined to a wheelchair or bed and then develop complications just like the ones I described for stroke can also be developed by them, and so they then have terminal disease that will worry individuals. Now we have problems with dementia because there's a lot of misconception about the disease. People feel that it's caused by evil spirit. Some people feel that drugs may not be useful in treatment. Many people that were interviewed in a survey. And some people feel that drugs may not help in treatment. None of the individuals feel that dementia is curable. Whereas there are those group of cases in which there may be a metabolic problem, and when you handle this, the individual gets better. I'm not going to bore you with details, just to show that there are various types of dementia and they can be differentiated based on the presenting symptoms, or you need to know them. Alzheimer's disease, Pick's disease, vascular dementia, and other forms. So I'm not going to bore you with this. Lastly, we'll talk about cancer. And just to show, this is a graph again from the archives, just shows that we have lots of cancers all over the world, and the deeper the color in red, the more the number of cases. I can see Nigeria is in deep red here as well. Nigeria, some parts of South America, Peru, Chile, and part of Europe. So those are places where you have a lot of cancer. So cancer is the leading cause of death worldwide, it accounted for about 8.8 million deaths in 2015. And the most common cancers are lung cancer, liver cancer, colorectal cancer, breast cancer, stomach cancer. In female individuals, we think of breast as number one. In male individuals, as we get older, it's prostatic cancer that we worry about. But lung is always there anytime you have smokers. And those are important challenges. And where you have a lot of alcohol consumption and hepatitis B infection, then think of liver cancer as major problems. So these are the global stats, the important cancers. You can see breast, prostate, cervical cancer, liver, lymphomas. Those are the ones that are problematic globally. But lung is still very high on the list, especially in countries where people smoke a lot. And we need to be aware of this. The risk factors for cancer, again, will be a repetition of what has been said. Smoking is number one here. Then obesity, being overweight and physically inactive, harmful use of alcohol, then viral infections, and exposure in various occupations can result in development of various cancers, and we should be mindful of this. So this is the last bit of the talk, which is to just talk about preventive strategies, because I've said so much about these various conditions and some of them are scary, but there are things that can be prevented. So just repeating the obvious, tobacco use, physical inactivity, and harmful use of alcohol and unhealthy diets are the ones that increase the risk of dying from NCDs. So how do we prevent premature deaths from NCDs? And the first one is to eat healthy meals. The traditional meals are very good. They may not be so palatable to everybody, but they are the best for preventing disease. And we should eat less of refined food and some of these things from the eateries that we have. The second point is that we should be physically and socially active. If we are, then we're able to burn off a lot of calories, and so obesity will not be a problem. And if there's no obesity, there's no diabetes, no hypertension, then we're sure that we can prevent a lot of these unusual conditions that are treatable. Then we need to modify our lifestyles. There are some of these conditions that are associated with certain lifestyles or dietary habits. A lot of salt in the diet can contribute to hypertension, so we need to reduce salt consumption. So don't add extra salt at table. You should stop smoking. You should reduce intake of animal fat and animal protein. We must avoid obesity and being very active, so we need to walk around the neighborhood. I think any vigorous exercise may not be too necessary, but just keep physically active and do this as often as possible. I think the next one is important, that we should drink more water and less of carbonated drinks, because the more carbonated drinks we drink, the more the sugar we are putting on our body, the more the calories, and the more the chance that one will become obese, and also one might be prone to diabetes. And please, you should remember that people have ways of hiding their intention. They come to the doctor, they pretend that they've listened to all the things that you've told them, but once they leave the doctor, they go on with their social habit. And you can see this obese person who's smoking away, is holding alcohol, and all these are behind the scene. Yet he's come to see the doctor to collect medication, which probably will not take. So that's the thing. So prescribing treatment is no guarantee of good result. So what we're proposing, what I'm recommending to ensure that we do all this is that we must preach a lifestyle and behavioral risk modification approach through education, so that we empower people knowledge and skills about all these things, harmful practices that can result in chronic cardiovascular problems. Through mass media, we can involve local health organizations. We can target special groups, women, children, youths. We can use community health workers for passing the information around when people come to primary health centers. Or we can use public policies to create an enabling environment to ensure that we can bring about lifestyle and behavioral risk modification. We can use the media, very powerful in this. We can have laws of advice on nutrition, things to stop tobacco usage, including imposition of taxes. We need urban planning to allow people to be able to recreate and exercise without any problem. We need to improve the health systems in general so that those who are ill can be attended to. And we need to involve the government, NGOs, professional bodies, private sector, and media in bringing about a change in attitude to health in general. I need to thank individuals who provided some of the slides, Dr. George Mensah, the CDC IUHPE group that I belong to, Dr. Okeoga, who provided some data on hypertension, Dr. Professor Okwechi of University of Cape Town, who also provided some data on non-communicable diseases perspectives, and then images from Google that are utilized for this lecture. I thank you very much for listening, and we have time for questions and comments. Thank you.